Welcome to the Heart and Vascular Center at Brandon Regional Hospital. I'm Dr. Joe Corcoran, Chief Medical Officer. We want to thank you for choosing our facility for your cardiac catheterization. We realize that having a diagnosis that requires cardiac surgery can be overwhelming for you and for your family. Take comfort in knowing that the skilled care provided by our cardiac surgeons and staff has been recognized by national organizations such as the Society of Thoracic Surgeons. Brandon Regional Hospital earned the highest recognition given for excellence in cardiac care from this prestigious organization. We've also been recognized for excellence by the Joint Commission, an organization known within healthcare for holding up the most exacting standards. We received their gold seal of approval on a number of cardiac procedures, including coronary artery bypass, heart failure, and acute myocardial infarction, and they rated us as a top performer for treatment of heart attack and heart failure. Awards and recognitions are an indication of quality healthcare, which gives our patients confidence in our abilities. But these honors could not be achieved without the exceptional, compassionate care provided by our cardiac team. At Brandon, we value accountability, safety, integrity, collaboration, and compassion. These qualities enable our staff to provide you and your family with the quality and compassionate care needed to return you to an active life. We're here today to answer a number of your questions and make you feel comfortable with your upcoming cardiac surgery. We'll be walking you through each step of the process to give you a better idea of what you'll be experiencing during your stay here at Brandon.
My name is Bradley Buffkin. I am a cardiac surgeon at Brandon Regional Hospital. I've been here since 2008. I'm originally from a small town in West Texas called Pecos, Texas. I did my medical school training at Baylor College of Medicine in Houston, Texas, and then spent 9 years doing cardiac surgery training at Emory University in Atlanta, Georgia. Been out practicing cardiac surgery for 15 years.
My name's Ignacio Duarte. I'm one of the cardiac surgeons here at Brandon Regional Hospital. I came to Brandon back in 2008. Originally, I was born in Central America, in Nicaragua. I was raised in Miami, Florida. I went to college at the University of Miami. Medical school was up at Columbia University in New York, and I did all my general and cardiac surgery training at Emory University in Atlanta. When I finished up there, I first worked in Dallas, Texas for about 2 years and then moved over to Tampa Bay area in 2007, and shortly thereafter came over here to Brandon Regional Hospital.
There are several steps that you will go through as far as from this point on till you're recovered from your heart surgery. The first part of that is going to be preparation for cardiac surgery, or what we call the preoperative interval. So from the cardiac cath lab, you're going to be transferred to a room and we're going to prepare you for the surgery. What that'll involve is a series of tests that we do ahead of time to make sure that your lungs are in good shape, your kidneys are in good shape, and you're overall ready to undergo cardiac surgery.
On the morning of surgery, the nurses will come by and pick you up pretty early in the morning, usually by 6 o'clock, to take you downstairs to start making the final preparations for surgery.
As you get down to the preoperative area, they're going to give you medication that's going to make you calm. It's going to soothe your nerves and prepare you to go to cardiac surgery in a confident and calm state. Heart surgery involves us making an incision on your breastbone and then placing your heart and lungs on the cardiopulmonary bypass machine, or the heart-lung machine, which does the work of the heart and lungs during the time that we're working on your heart, be that bypassing the arteries that carry blood flow to the heart or working on valves within the heart. Usually that operation lasts about 4 hours. After we're done with the surgery, then you will go to the intensive care unit. Cardiac surgery is a big deal. We recognize that. There's a large team that's going to be involved in your care. Myself, my physician assistant, anesthesiologist, the perfusionist that helps us run the heart-lung machine, the scrub techs that hand me instruments, the circulating nurses that are part of gathering the equipment that's needed for the operation, as well as the attendants that help the anesthesiologist and the circulating nurses. Your family will be updated during your operation. They'll receive a phone call from the circulating nurse as we begin the operation and at key intervals during the surgery. As soon as I feel comfortable leaving your side, I'm going to come out and visit with your family and let them know how the operation went, how you're doing, and we'll prepare them for their visit with you early post-operatively.
Initially from the operating room, you'll go to the intensive care unit. At that time, you'll still be asleep, unconscious, with the breathing tube in place connected to the ventilator.
That's going to be there for a couple of hours as you recover from the operation and as your heart and lungs become strong enough to remove that breathing tube.
We typically keep the patients asleep about 4 to 5 hours. At that point, we'll start waking you up from the anesthesia, and if your heart and lungs are doing well, there isn't too much bleeding, things look good, we'll start working on getting the breathing tube out at that point. We try to do that within 6 hours of arriving to the ICU.
Usually the next morning, if everything's gone fine with your surgery and you're doing well, we move you upstairs to our progressive care unit. And at that point, we really begin the rehab element or the recovery element of cardiac surgery, which involves you walking, you breathing deep and coughing. All of these things are important in your recovery from surgery.
Soon after you're transferred to the floor, also one of the case managers will meet with you and your family in preparation for discharge planning. We always prefer to send the patient home with their loved ones. We always believe nobody's going to look after you more than your loved ones, but we like to ensure that they feel comfortable doing so and that that person will be able to continue to take care of you well. If not, the case manager can work with you and your family and try to identify a rehab facility close to your home that you could go to until you are strong enough to be home alone more.
Our standard length of stay is 4 post-operative days. Usually on the 4th post-operative day, we're making preparations for you to go home. That will include organizing appointments with your cardiac surgeons, with your cardiologist, as well as your primary care physician, and providing you and your family with an important letter that's personally addressed from myself that goes over the 10 things that I think are most important for your recovery.
About 3 to 4 weeks after surgery, if you're healing well and things have progressed nicely, then the cardiologist will refer you for phase 2 cardiac rehab, which is more of a gym type setting, but with telemetry monitoring, with the nurses guiding you, including lifting small weights, treadmills, Stairmasters, and things like that to help push you over the final hump in a monitored setting.
What cardiac rehabilitation provides for you is an opportunity to get together with a group of individuals that have all had a similar experience, which always helps in the recovery of our heart surgery patients. Additionally, they give you outlines of ideas for diet modification, for exercise opportunities, and really just prepare you for the recovery after cardiac surgery.
Normal recovery, usually most folks we'd like to have them walking about a mile or so, not all at one time and not as a race, but throughout the course of a day have accumulated about a mile or so when they come back to see us in the office at 3 weeks.
Start off in the house, then out to the mailbox, then around the block, working up to that mile a day by the time you come back to see me in 3 weeks.
Most folks at that point, if they're off pain medicine and they feel comfortable making the motion, they can start driving again. About a week thereafter, we can release them to light-duty desk-type work for maybe part-time for a week or 2, and then full-time after that. Anything more strenuous than lifting about 5 pounds, we do like to wait at least 6 to 8 weeks to let the breastbone heal really well following the operation before increasing the activity to that extent.
Our staff recognizes what you are experiencing and wants to make your stay here at Brandon Regional Hospital as calming and comfortable as possible. If you are experiencing pain or any unusual symptoms after your catheterization, please inform your nurse. At Brandon Regional Hospital Heart and Vascular Center, our goal is to provide our patients with quality care through innovation, education, and compassionate care. Thank you for choosing our facility for your cardiac surgery, and we look forward to caring for you during your stay here at Brandon.